The thing that's scary to me is when we have conversations like this, you have to recognize how close everybody is to that threshold of being in real serious trouble. I want to say it's like 80% of US households struggle financially, aka being paycheck to paycheck. When you add a diagnosis like cancer on top of that, debilitating. And the biggest challenges we face in society today aren't, some of these big challenges that we talk about with like wars and pandemics, but isolation and loneliness, especially as a family goes through these challenges. Who do they reach out to? Who do they lean on when they're by themselves and they have to sell their furniture in order to put enough jelly on a piece of bread to feed their children? It sounds like an incredibly scary time for so many people. And then you insert yourself right into it to be that community to help people in these times of need.
That's right. There's so much fear and shame in talking about your finances. And when cancer strikes, a lot of people feel shame that they even have cancer. So some people just naturally retreat. And so that we've got to wipe out the fear and the shame and let people know that this is cancer. You did nothing wrong. You pulled the cancer card. It's happened to me. There'll be 2 million new cancer diagnoses this year. And 1 out of 3 of those cannot afford their basic needs: housing, food, transportation, utilities. So until we make people comfortable talking about finances, talking about cancer, we're still just going to meet families when they're in crisis, when it's too late, when there's so much that can be done about it.
All right, guys, welcome back to a brand new episode of the Hart Hustle Podcast. I'm incredibly excited because I have an amazing leader of an amazing organization sitting across this digital table with me. Now, today I'm sitting across from the CEO of Family Reach. Carla, welcome to the show. I'm so excited for you to be here.
It is so good to be here. Thank you for your passion. Thank you for opening up so many doors and minds and hearts. It's an honor to be here.
Absolutely. Well, we're going to talk about a couple things today. We're going to talk about some of the misconceptions and the financial strain that families who have an individual or are dealing with a cancer diagnosis face. We're going to talk about navigating resources. We're going to talk about destigmatizing financial conversations when people are suffering from cancer. We're going to talk about your personal journey as well. But to start us off here, I thought it was really important to talk about a promise that you made to a friend. Now, you made a promise to a friend that changed the trajectory of your life. Can you tell us what that promise was and what happened after?
A dear friend of mine from college, I went to Syracuse University. He played football for Syracuse and then he went into the NFL. His name was Pat Kelly. This guy was larger than life. He is one of these people that just sucked you in and really just lived large. And he got brain cancer shortly after his son was born. A son who shared his name was 3 years old when he was diagnosed with brain cancer. He was treated at Memorial Sloan Kettering. He would, during his treatment, just because of who he is, he would go down to the pediatric floors. He'd bring Jets players. He played for the Jets, really just to cheer these kids up. And while he was down there, he was listening to parents and he was like, wait a second, nobody's talking about cancer here. They're talking about the fact that obviously if you're there by your child's side, you're not working and income is dramatically cut. And he was hearing people talk about the fact that they're finally getting released from the hospital, but there's no heat. And what are they going to do? And then one little girl was crying because she hadn't seen her dad in a month. And the mom was like, parking is $45. We can't both come here every day. So he just kept calling me every time he'd visit these kids and he'd say, all right, there's this whole other side of cancer that nobody is talking about that we need to expose. So about 2 weeks before he passed away, a bunch of us went down to just say goodbye, celebrate his life. And he could only whisper at this point. He was so weak, but I was sitting next to him holding his hand. He squeezed my hand, which means look at me. I looked at him and he said, look me in the eye and promise me you're going to fix this. And I knew exactly what he was talking about because he had made so many phone calls. And I said, I promise I will. Keenan and I had no idea what it was. I knew, he's talking about basic needs for cancer patients. I said, I promised because I felt that stare in my soul, but I had no idea what I was promising.
It's so heavy to think about how your world changes when you're dealing with a family member or a personal diagnosis of cancer. Naturally, you go to the place of, oh my goodness, am I going to be able to survive this? But then the real life implications come behind that of, oh my goodness, how are we going to be able to afford this? What sacrifices are we going to make sure that you're okay? And so often that means choosing between rent or choosing between food or choosing between education. And so many people make these sacrifices in the dark. And I feel like even having this conversation is kind of like illuminating the space more so to recognize that these are huge challenges that people face today.
It's math. You have cancer or a loved one has cancer because you said at the top, cancer affects the whole family. So when we talk about cancer, it is very likely that you have the person with cancer, but you have many other people affected, immediately affected. You can't work, or your job is interrupted or completely stopped, and so is your income. But the bills keep coming. The monthly bills that you and I have, they keep coming. And for a cancer patient, they grow because of the cost of care and because of all of the out-of-pocket expenses required to access care and to stay adherent to care. So it's literally math, and it doesn't add up.
When you left the bedside of Pat and he says, you have to figure this out, what was the journey like in you kind of digging into, I would say, the mud and recognizing the challenges that people were going through? I'm sure you found a lot of, I would say, eye-opening experiences during that time with people being challenged financially and the math just not adding up.
Yeah, well, at that point I had my own company. I had an event planning fundraising company, and I thought I had my path. I thought I knew what I was doing. And I, to be totally honest with you, had his picture on my desk, and for about a year, I turned that picture around because I was like, stop looking at me. I don't know what to do. I have 2 young children. I am running this company. I just don't know what to do. And then I hit a point where I'm like, okay, I've got to figure this out. And one of my clients at the time, so I decided I was going to shut the business down. And I was going to dedicate myself. Talked to my husband. I said, all right, I'm banging a Yui here. I cannot live with myself. I have to figure this out. So met with one of my clients to say, I'm going to close shop. I have to do this. And it happened to be the founder of Family Reach, who lost his sister. She was treated at Memorial Sloan Kettering. She was 27 years old. She had a pediatric cancer, Ewing sarcoma. She saw the same thing Pat did. And on her deathbed, made her family promise that they would address basic needs for cancer patients. So this family and another family, the Colangelos and the Morellos, had gotten together 12 years before this moment, and they were helping cancer patients with basic needs in the 2 hospitals where their children were treated, Memorial Sloan Kettering and New York Presbyterian. So when I made this big announcement to Rick Morello, he just said, oh my gosh, that is my family's foundation. Here's how we do it. We talk to social workers in the hospital. We say they raised money. They said this money is not for the hospital. This money is for the social workers to distribute directly to families with basic needs. So when he said that, I was like, of course, you have a model that I can just scale. And that's how it started. It was sitting there the whole time.
Do you believe in fate, Carla?
Heck yes. And if I didn't before that moment, I did at that moment.
So what is the experience like when, we're saying, okay, I'm going to have to jump this chasm. I'm going to shut down my current business. I'm going to start pursuing this. But yet the last client who you speak to says, I have a vehicle for you to do this. What are the feelings that are going through your body? What are the realizations of the work that it's going to take to kind of transfer into this space? What were those early days like for you?
Yeah, I knew I had a lot to learn. Nobody sets out to do this work. I didn't understand it. It didn't make sense. The wealthiest country in the world are these people that don't have health insurance? Are these people, like, what is it? So I did spend the first 2 years literally talking to the social workers in the hospitals. They said, here's families that are struggling, literally sitting in their hospital room. What is going on? You're here. How are you paying the bills? So going into their homes, literally sitting in their kitchen. And I remember one family, I walked in and her daughter had cancer, and she and her daughter and her son were sitting at the table. They had a piece of bread with a little bit of jelly on it, and this is what they were eating. And she's like, this is all I have. This is it. and opened the cabinets for me, and they were empty. And so I spent about 2 years in the healthcare system, in patients' homes, in the hospital's rooms saying, talk to me. What is this like? How did you get here? And if you had a magic wand, what could I do? And I learned so much in that time. And I wasn't prepared for it in that I left that woman's house and I went to the grocery store to buy groceries for my family, but now I have 2 carts. And now I am filling up a grocery cart for her. And I'm going back to her house to fill her cabinets before I come home to fill mine. I'm on the phone with the social workers were referring patients to me. And there was one moment where this woman had just sold her furniture to pay for her heat. And I said, do you need a couch? And I could see my husband in the doorway behind me going, really? Really? You're giving away the couch? And so I was so in it and not prepared for the emotional toll that it took for me. I'm a fixer. I'm like, what do you need? Let me do it. Quickly realized it was way too big for me to be addressing it in this manner, and knew I needed to surround myself with a team that could address it in a more sustainable way.
The thing that's scary to me is when we have conversations like this, you have to recognize how close everybody is to that threshold of being in real serious trouble. I want to say it's like 80% of US households struggle financially, aka being paycheck to paycheck. When you add a diagnosis like cancer on top of that, debilitating. And the biggest challenges we face in society today aren't, some of these big challenges that we talk about with like wars and pandemics, but isolation and loneliness, especially as a family goes through these challenges. Who do they reach out to? Who do they lean on when they're by themselves and they have to sell their furniture in order to put enough jelly on a piece of bread to feed their children? It sounds like an incredibly scary time for so many people. And then you insert yourself right into it to be that community to help people in these times of need.
That's right. There's so much fear and shame in talking about your finances. And when cancer strikes, a lot of people feel shame that they even have cancer. So some people just naturally retreat. And so that we've got to wipe out the fear and the shame and let people know that this is cancer. You did nothing wrong. You pulled the cancer card. It's happened to me. There'll be 2 million new cancer diagnoses this year. And 1 out of 3 of those cannot afford their basic needs: housing, food, transportation, utilities. So until we make people comfortable talking about finances, talking about cancer, we're still just going to meet families when they're in crisis, when it's too late, when there's so much that can be done about it. So a big goal of mine is to make people comfortable talking about their finances and to know they did nothing wrong. But I just want to say one more thing about the fear. If you're a parent with cancer, or if you have a child with cancer, and you go to your social worker or you're at a hospital and you say, I'm about to get evicted, or I don't have food, your children could literally be removed from the home because you cannot afford basic needs. So that fear, I want to just say that fear is real and I understand it, but there is help and there are ways we can help.
That was going to be my question. Why is family reach even necessary, right? If you can go to the hospital and you have a diagnosis and you say, hey, I'm struggling here financially, obviously there are other implications that I didn't really know about, but social services coming and taking your children away, things like that, that sounds incredibly scary too.
Yeah. Yeah, it adds to the stigma and it adds to the fear. And I know a lot of people think, and it's true, the hospital is focused on your cancer. And cancer patients are patients. I had the opportunity to shadow a pediatric oncologist. She was a brain pediatric oncologist in Florida at a fantastic hospital. And she allowed me to shadow her for the day because I wanted to understand, what is it like for the healthcare provider? I know what it's like for the family. What is it like on that other side? So this woman was saying, we're going to go talk to this little boy. He's 7 years old. He has Down syndrome. He has brain cancer. He has been fighting for 2 years. He has had brain surgeries. He's had radiation. He's had chemotherapy. The tumor is growing. We are going into this little exam room to tell this family that the tumor is growing. And we walked into this room and this little boy is squirming on his dad's lap. And the doctor is saying, we've got to get this tumor out. He needs to have surgery. And the mother said, I'm sorry, he's so fussy. We left the house at 4:00 this morning. I hear that. It's a 5-hour drive for them. But the doctor is like, I've got to cure this little boy. And she said, he needs another surgery. The surgical team is waiting on the 3rd floor. You're going to leave here. You're going to go schedule your surgery. And the dad says, how long is this going to take? We have 2 little girls that get off the school bus soon. So they're looking at their clock saying, our little girls are about to be dumped on the side of the street. We got to get home. And then he also asked, when did she need the surgery? Because I'm all out of paid time off. But the doctor says, if he does not get the surgery, he will not make it, go to the 3rd floor. And when we left that hospital room, I said to her, with all due respect, they're not going to the 3rd floor. They can't. And they didn't.
How do you put yourself in an environment like this where these are people who are going through some of the toughest decisions of their lives? It's so emotionally charged. How do you find yourself doing this work without absorbing all of the emotional baggage and trauma that comes along with this? Because this can't be easy for you.
No, it's funny because I still get choked up when I think about it. And I will tell you, myself and everyone on my team have tissues on our desk. And there are many a days where we are grabbing for those tissues. And I've had team members say, oh my God, when does this get easier? I'm like, when it does, you got to go, because that means you don't feel it anymore. And it is hard to feel, but you got to keep showing up. And I do have hope. And I do know that we can fix this. And I do feel like we are on the verge of change. I've been doing this for 17 years. And pre-COVID, when I would talk about health equity, those words were not together in a sentence, but when I would talk about what we see in the patient reality, people are like, they didn't understand it. COVID at least pulled back the curtain on what is health equity, what is isolation, what is job loss, what is food insecurity, what is housing insecurity, what is a fear of getting sick. I mean, all of that is cancer. So when COVID was hitting and we were hearing all of this, I'm like, oh my gosh, this is cancer. So don't forget, when we get to the other side of COVID, don't forget fear, isolation, housing insecurity, food insecurity, because that is what patients are still living with every day. So hold on to that, because we can fix this, but we do need everybody to have the courage to look at it so that they can help with the solution.
Part of my natural inquisitiveness goes to the fact of, does it have to be this way? Because the cost of these surgeries are so expensive. The insurance structure is not meant to be able to protect people when they're going through this. It's either choose the surgery or don't choose the surgery. And if you don't choose the surgery, you know what's going to happen. So what do we need to change, just from like a ideological perspective of how the healthcare system works, so we don't have families who are having to choose between my family or my living, which is a really tough choice to have to navigate.
Yeah. I mean, the healthcare system is broken, and I am so focused on the patient reality and the patient journey. My North Star is when someone is diagnosed with cancer, they get their medical treatment, but they also get the financial treatment. Right away, you are going to know about the utility hardship programs. You are going to know about food delivery programs. You are going to know about SNAP benefits. We will get to a point where we can build in this safety net so that you can access care and adhere to treatment and have the best shot of beating this disease, that everyone has the same chance of beating this disease. So I don't know the answer on how to fix a broken healthcare system, but I do know that financial health needs to be a standard of care so that we can increase cancer survival rates.
This goes back to the whole person view of care, right? It's not just mental, it's not just physical, it's not just, it's cardiovascular, but it's also financial. There are so many different elements that impact somebody's livelihood, but also longevity of life and happiness that we need to focus on. And I wish that healthcare systems had the ability to respond in the way that we're talking about, but it almost seems like the system in which they operate in doesn't give them the opportunity to spend the individualized time that it takes to educate somebody about these type of things. It's basically all on the patient's experience. We're just the clinical aspect of trying to get these things done. But that seems like a really backwards way to approach it.
Yeah, and I see them trying. I mean, I'm seeing hospitals now, a handful of hospitals put food banks in the hospital. That's phenomenal. So a patient can say, I know we have a food bank here. I'm food insecure. They literally get a subscription for healthy foods. That is a fantastic step in the right direction. I have a lot of hospitals say we do social determinants of health screenings now. I do think we can catch some people there too that say I'm having trouble, or yes, I live alone and I can't work, so of course I'm not going to be able to pay my bills. I think a lot of patients don't answer those honestly because of the fear and the shame. We partner with over 1,200 hospitals across the country. Their oncology social workers have access to my team, but more patients come to us through our website than through 1,200 hospitals because of that fear. They are more comfortable on their own trying to get this basic need met. But I am seeing some change. I am seeing some hospitals sort of embrace this fact because they're seeing patients, 31% cut their meds in half. Another 32% don't even fill their prescriptions. Of course they're not going to survive cancer. So I think they're starting to understand how basic needs and health equity are affecting their ability to treat somebody with cancer.
How do you guys create scale to be able to support 1,200 plus hospitals? Do we have team members in these spaces? Are we talking about like a portal that team members can access? What does the implementation process look like so they can take advantage fully of Family Reach when they're at the patient interaction space?
So I have a team of social workers and navigators that are working with the hospitals and working with patients directly. What we have done, we're really leaning into health equity. There's a stat that the American Association of Cancer Research came out with that 1 out of 3 cancer deaths in this country could be prevented by removing socioeconomic barriers. That is my North Star. We can increase cancer survival rates by addressing basic needs and removing these financial barriers. So in addition to the hospital partnerships, we've got this heat map of the United States, and we're looking at diagnosis rates, mortality rates, poverty rates, and we're going into those areas to find community partners who in those communities are dealing with cancer patients in the community. They have the trust, they're in their neighborhood, they have the conversations freely, and to say, here's our financial interventions, financial education, resource navigation, emergency financial assistance. You disseminate these financial resources into your community. So through partnerships with hospitals, partnerships with community partners, those community partners become an extension of who we are. So we're training the trainers. And then we have a subset of my team that is working with patients that come to us directly. But to answer your question on how we scale, we have tens of thousands of basic need resources across the country, and we had hundreds of people waiting in a queue to talk to one of my navigators, and that was keeping me up at night. So knowing we need to train more trainers so that they can do this work using all of our resources, we built an online platform that patients, caregivers can access by going to familyreach.org, going to our website, clicking on Get Help, and they can download all of this information about how do I talk about my finances, who do I talk to about, how do I save money, what do I need to know? Let's just normalize the conversation around finances. You can also go to the navigation portal and enter your zip code and say, I am housing insecure, I am food insecure, I need utilities. And then all of the resources in your encatchment area pop up. And they have all been vetted within the last week. They are all viable. They are open. We are not sending you down a rabbit hole to waste your time. What you see there is open. You can see the hours they're open. You can see the address. There's a phone number if it's an application. So that that navigation platform is incredible for patients that are more comfortable doing this on their own. And they can see which emergency financial assistance funds we have open. If you're trying to get to a clinical trial, we have a clinical trials access fund. We have a pediatric fund. We have an adult fund. So this online portal, this online platform is how we are scaling. We launched it a few months ago. We haven't told anybody about it. I can see the back-end analytics. I can see all the activity. There's over 82,000 searches on this site from cancer patients looking for basic needs, and we haven't told anybody about it yet. So this is how we are going to scale. A really long answer, but I love
No, a beautiful answer, because we have to think about these things differently, right? And the reason why I asked, what does the training, the implementation process look like inside the hospital? Because I understand the dynamics and the pressure that's on the nursing staff and even the social workers inside of the hospital. It is constantly moving to get to the next patient to do X, Y, Z. And so when I think about access on someone else's own terms, we have to create a digital environment, from my perspective, that they can access 24/7, 365 to do that self-navigation. Because you'd be surprised, or people who are listening to this podcast, about how many people do not feel comfortable talking about their personal situation, especially finances, to somebody in a clinical environment. It just doesn't seem right. There's stigma behind it. There's fear. There's judgment. There's all these different type of feelings. And to think about how we can just create a better sense of community around this conversation is incredibly important. Did you guys ever try anything else different before you guys went into the digital platform realm? Or why was it, hey, we have to create this space that obviously has so much traction? How'd you guys come to that decision?
Yeah, we've tried so many. We are innovators. I mean, we've been doing this work. Family Reach has been around for 28 years. I've been in this space for 17 years. So dare I say, we pilot so many different things. How do we reach patients? What do they need? We do focus groups. We partner with, as I said, community partners. We just really want to learn and meet patients where they are with the program that they need. So we have partnered with other nonprofits in the cancer space to say, you do great work here, but you don't do financial assistance, let's partner. So partnerships are really important to meet the patients where they are. And then just understanding, where is the patient comfortable, and are they willing to open up, and then how do we make sure that our resources are there. So I think what we've tried new is these community partnerships with nonprofit. We've done fundraising is a massive challenge for us. So we are giving away emergency financial assistance that there's not enough money for us to address this need. So we are giving away funds. So fundraising, storytelling, awareness is a huge part of what I do all day long, so that we can help another family that is in a waiting line right now. We are knowing there's not enough money to help with the basic needs of all the cancer patients. We are forming partnerships with hotels, with utility companies that have emergency funds, so we can plug patients into these programs or through our partnerships that don't cost us anything, but there's empty hotel rooms. I have patients that need to get to a clinical trial in New York. It's very expensive to stay in New York. So we partner with an airline, we partner with a hotel, we got you covered. So I think, the way we approach this is entrench ourselves in the patient journey. What do they need? How are we going to fill those gaps? All boats rise. How do we do this together? But raising awareness for the problem, raising awareness for the patient reality is step one, because people just don't know.
If you could go back 17 years to that version of Carla who was just starting on this journey, right? Recognizing all the challenges that you faced between now and how we sit across the table from each other here, what advice would you give to that younger version of yourself as they were going to navigate this next 17 years?
Nobody has ever asked me that question. One thing that I do well is surround myself with really smart, compassionate people. And I think I would So I'm really proud of the people that I have been able to get on board and to open up. What took me a while, I felt very protective of the families that we were helping. One of the first families that I met was a single mother. She was in her 20s. She had a 4-year-old with leukemia who had just relapsed. He was first diagnosed at 18 months. She was living in a homeless shelter for 2 years with this little boy with cancer because she couldn't work. He needed a bone marrow transplant. The hospital said, we've got a match, but he can't get this bone marrow transplant if you're in a homeless shelter. It's just not sanitary. So I ended up getting her out of the shelter into an apartment near the hospital so he could get this bone marrow transplant. I protected these families so fiercely because I knew how much courage it took to talk about what their situation was. And it was this woman, a year after coming out of isolation, her son is still with us today. He's 19 years old. She tapped me on the shoulder and said, let me tell my story. I don't want anybody to go through what I went through. I would tell my younger self, ask the families if they want to talk about it. Give the families an opportunity to say, this is what happened to me. This is how I got help. This is where we are today. Ask for help. Once I gave families that platform, the message became so much more clear and so many more patients were willing to come forth and say, I need help. I wish I had done that sooner.
We have that natural instinct, right, to insulate the people who we care about from any type of trouble or additional harm. And it's a really tough battle to recognize that sometimes you have to step back so they can step into their own pain to be able to help you guys execute on the mission and share the mission and the vision that you guys have been able to articulate.
It empowered her. And she said it she stood up at an event with a few hundred people and told her story, knees shaking, voice quivering, stopping to cry. But when she got off that stage, she said, I'm not the victim anymore. Now I'm going to lead the way for others. Dramatic change.
You've been doing this work for 17 plus years now. How do you think about where you guys are going? What vision are you casting for the team so they can all buy into what the next 17 years of this is going to look like? What are you thinking about?
I'm thinking about this ecosystem outside of healthcare. I'm thinking about all the hospital partnerships, the airline partnerships. I'm thinking about getting every single cancer care center in this country to have access to my financial resource center. I'm thinking about major donors who understand health equity and understand that there are people dying from cancer when there is a treatment, when there is something that can be done about it. And I am thinking about making financial health a standard of care, every hospital having access to this financial resource center, me being able to fill my emergency financial assistance funds every month. I think we've got it. I just need to scale it. We've proven it works. We just need to get people to talk about it. We're there.
How do you balance one of the biggest things that I've had to come to realization is sometimes the impact that we're waiting for takes time. And time often takes time. But often I feel like I'm impatient because I want to get there quicker. But I also recognize subconsciously, if we just continue to march, we will have the impact. But how do you kind of deal with the feeling of being impatient because you know so many people need more help?
Yeah, amen to that. My team says, my God, you work with such a sense of urgency. And I do, because I look at the queue. I know these patients personally. So that sense of urgency will never go away for me. What I often do to my team is take a minute and to look around to see what we're doing. 1,200 hospital partners helping 40,000 cancer patients a year, built the Financial Resource Center, 80,000 plus people on the center getting help. Look at the wins, celebrate the success. That fuels us to keep going because what we're doing works. The people we are reaching are staying on treatment, getting to the other side of cancer, coming back to us to say, how do I pay this forward? How can I help? And that is what fuels us. It's just a numbers. I remember the day we celebrated, we helped 100 patients one year. We thought that was the greatest thing ever. We've helped 100 patients. Now we're up to 40,000. So now, of course, I'm like, how do we get to 250,000? I also know that I'll never be done. Yeah. I'm always going to want more.
We are playing the infinite game, but it's so important for us to not find ourselves in the gap between where we are and where we're trying to get to, but often the gain of how far we've come. If you could talk to that version of, Carla, who said, we just supported 100 patients this year, and she say, wait for the future because you're going to get 40,000, right? That would be an amazing story to be able to talk to our previous versions of ourselves. One of the traditions we have here, Carla, on the podcast as we kind of wrap things up is our previous guest wanted to ask you a blind question. Now, their question was, who has had the greatest influence on your life?
Pat Kelly.
Did you think that simple conversation was going to change the trajectory of your life in the way that it did?
Not in a million years. I still talk to him every day. You asked, do you believe in fate? There are many days where I'm like, Pat, I need this. Pat? Pat Kelly, he got me into the White House, part of the cancer moonshot, working with Biden, Obama, it's ask for it, believe in it, know that you've got a tailwind. There's people looking out for us. Just ask for it.
Well, Carla, I think it's easy for everybody to understand who's been tuning in, watching, and listening today why you are the definition of heart and hustle. We can see the heart behind what you do and the hustle that you create every single day and the urgency in which you work to help people who need that voice of support who often can't raise their own hand. And so I just want to say thank you so much for coming on the podcast. Seriously, this has been an absolute blessing.
Thanks for helping me tell the story. I hope we reach people so that they can get help.
Absolutely. Well, guys, that's a wrap. We'll catch you in the next one.